Every morning when our center opens, we have a lobby full of guests with great needs. We can meet some of the needs, but never all of them. Our guests come with many barriers that have contributed to their homeless or near homeless situation, or barriers that prevent them from overcoming their situation. Our goal is to try and remove as many barriers as we can. However, the services that we offer during the morning will not remove all of the barriers. Many of the barriers are at a higher level, and this is where we see public policy advocacy come into play. The laws that are passed on a county, city, or state level directly or indirectly affect the people that we serve. Many of our guests are affected by drug policy.
You know, we are the product of where we've been and where we think we're going. There would be no place other than right here I need to be today because of a series of experiences that have happened behind these lenses. I heard the stories of 5 individuals who had served their time, who had done everything they needed to do to re-enter our community. And everywhere they turned, they got a no. And so on that day, my life changed because all of a sudden, the comfortable advocacy that I had always thought I engaged in my community, took a new turn. And I promised those 5, and I have continued to promise folks that I'm not going to stop being an advocate until life is better for all God's children.
I think we can all essentially agree, however, that drug policy in the United States overwhelmingly has failed. Drug usage rates have not declined. Illegal drugs are more available and cheaper than ever before. At the same time, the costs of the supposed drug war are staggering. In Georgia, 1 in 13 adults is under the Correctional Systems Authority, leading the nation in the number of adults under correctional authority. So that includes jails, prisons, probation, parole, and all of that. So we also know that there's a strong interconnectedness between incarceration, homelessness, and substance abuse, all of which are strongly impacted by drug policy. Last year, we did have one bill that was unanimously supported, the HB 1176, which modified several sentencing provisions, including reducing penalties for certain drug offenses. This was definitely a step in the right direction.
Harm reduction is about relationships. It's about us getting to know the people we serve. It's about the people we serve getting to know us, and more importantly, to trust us. We try to meet a lot of needs. We try to reduce as much harm as possible, from a place to come in from the elements, from the streets, to water, to our stated purpose of HIV, bloodborne pathogen reduction and prevention. The Atlanta Harm Reduction Coalition runs, as far as we know, the only syringe exchange in the state of Georgia.
Every supportive housing project has to coordinate services. Okay, the people have got to have services to be supported in their housing. You've got to have capital, and the capital's virtually got to be free, because you're not going to make any money off of this to pay a huge debt service. And the final thing, it has to have rent subsidy. You can't operate, you can't pay the rent, you can't pay the utilities, you can't keep the grass cut and make the repairs without rent subsidy or rent coming in. Those are 3 of the major components of supportive housing. There's no bigger social justice issue in my lifetime than this issue of Medicaid expansion. Everyone should be going on the Cover Georgia site, signing a petition. If you have an organization, join the coalition. There are 60 organizations that are part of that organization right now. You can sign a petition, you can get these cards. There currently have 1,300 people that have signed the petition, but you have to get involved in this Medicaid reform issue. in terms of supportive housing, that's where the services come from. That's how the state can finance all the services we need to keep people in housing.
The lifetime ban was put in place in 1996. It's a federal statute. It says that people who are convicted of drug felonies can never get food stamps. They can't get them after they get out of prison, they can't get them after a few years back in the community. They can never get them. Food stamps recognize that households buy and prepare food together. So when you penalize the drug offender who goes to live with his spouse, his children, or her children, his or her parents, or supportive friends, all those people are penalized by the ban. The children have less to eat, the spouse has less to eat, the parents who've taken the offender back in have less to eat. Those are the people affected. It's a terrible, terribly directed punishment. And of course, the ultimate effect is, the ultimate thought to have is, do we really want to punish people by making sure they don't have enough to eat? That's not a punishment that makes a lot of sense. Georgia pays every dollar to feed people who are in jail, but it's turning away this money that could feed people while they're out in the community, hopefully keep them from going back into jail. It's really a shame, and it's an opportunity we should pick up on.
If you have a record in Georgia, Georgia is ranked the second worst in the country for creating barriers. And this is a quantitative measurement, not a qualitative measurement, meaning we have over 700 collateral consequences. If you have a record, and a record in Georgia, we're not talking convictions necessarily, as Charlie was talking about, we're talking about just arrests. Let me put this in perspective. Georgia is estimated to have almost 1 in every 3 people in Georgia. This is from the GCIC, the Georgia Crime Information Center. 1 in 3, maybe as low as 1 in 4, have a criminal record in Georgia. Nationally, 65 million people have a criminal record. The South has always led the way on so many things, including criminality, and at least arresting people. And so we often lead the country on the percent of folks who have a record. So you take this huge chunk of people in Georgia, you know, millions of people we're talking, right? And you say, if you have just an arrest, that it can stop you from getting a job, from getting housing, from going to school, from all these other things. And of course, convictions lead to more barriers. Folks in the room here, I don't know you, all of you, but I know many of you come with experience with personally, professionally, the work you do, your churches, your synagogues, whatever, you are committed to these issues. That experience makes you an expert in a way that folks down in the State House do not have. You have incredible opportunity to make a difference.